My neighbor keeps walking by the door back and forth. I hear him screaming at night. He wants to kill me. Is it real? Am I real? The person looking back at me in the mirror is nothing short of evil.
Hi, I'm Laura. I'm a registered psychiatric nurse. I specialize in inpatient adult care. I've been a registered nurse for about 10 years. Most of it has been in adult psychiatric care, but I have done some work on a geropsychiatric unit and an adolescent unit. I am board certified in psychiatric nursing, and I love what I do.
Have you ever cared for a patient who was admitted for experiencing psychosis?
Yes, in my work as a psychiatric nurse, I have cared for individuals with a variety of different mental illnesses. Psychosis is one symptom that is very commonly seen in my psychiatric nursing care of those individuals. Well, when the term psychosis is mentioned, it can mean a lot of things. On social media, you might hear of someone saying they're psychotic. Typically that means they're crazy. They might be acting strangely or bizarrely. On the inpatient setting, when we look at psychosis and see certain signs and symptoms of it, it would reveal itself more in the classic understanding of it. A person might have delusions. They might think that they are a rock star in a band and they need to go play at some big venue. They might have a paranoid delusion of feeling like the CIA or the FBI are following them. Their accounts are getting hacked. People are staring at them. That might be a negative delusion. There's also the auditory or visual hallucinations. People will hear voices telling them to kill themselves or others. That can be more concerning. Or they might hear voices saying bad things about them. That could be another form of psychosis. Psychosis can also be in the way that they behave. They can be grossly disorganized, as we would say. They may not be able to figure out how to get up and go to the bathroom. They may just stay in bed and stare at the wall. That might be a form of catatonia. They might be manic and pace the hallways up and down, feeling and expressing a lot of anger at people. Other forms of psychosis might be when you ask questions. How are you feeling today? How are you doing? Maybe even more specific, what brought you to the hospital? The answer might be very long, confusing, disorganized, and as a nurse trying to understand what they're saying, I sometimes am taken on a journey of all sorts of varying paths of, well, they came in because their brother brought them, but their brother really is jealous of them, and then their mom is sick, but then grandma died last year, and there can be this whole circuitous route of trying to figure out why they actually came in. So the causes can be many and varied, and it's always important when I have a patient who is exhibiting psychotic features to really read the notes about why they came in. I like to look at lab results. What about their thyroid? Are they positive for a substance like methamphetamine or marijuana? Is there a report from the ER physician or the psych clinician evaluating them that they took psilocybin possibly? So there could be like a drug-induced psychosis. There could be a backstory of multiple deaths in the family that they might have experienced and a job loss as well. Multiple compounding factors could have caused just trauma that overrode their ability to cope. Is there a diagnosed psychiatric disorder? A diagnosed psychiatric disorder with psychotic symptoms could be schizoaffective disorder, schizophrenia. It could be bipolar 1 or 2 with psychotic features. It could be major depressive disorder with psychotic features. I reference a substance-induced psychosis. Sometimes I have a very honest conversation. You need to take these medications. That would be the first approach, making sure they're taking medications to reduce some of that psychotic delusional thinking that can affect their metabolism, their weight, their hydration status, just their overall health status. Sometimes just being very clear and speaking the truth and reassuring them that they're in a safe place. Reality orientation, grounding is very important in helping patients who have a lot of psychotic delusions or fears or anxieties. There can be such a wide variety of how the psychosis manifests itself. They could have delusions about people trying to hurt them. They could have delusions about being married to famous people. They can be angry that the world is out to get them. If they are particularly manic and angry and very upset about how things are going, that can be very challenging. If they are not following a logical sequence of instructions, that could be very challenging. Early intervention with patients who experience psychosis. The research supports that early intervention is critical for creating a longer trajectory of stability over the course of that patient's lifetime. Diagnosed in maybe early adolescence, teen years, the sooner the screening exams are done for any concerning behaviors, the better. People can recover and they do well being in the hospital, but early intervention tends to lessen the likelihood of those hospitalizations.
I'm lying in my bed, the blanket is warm. This body will never be safe from harm.